Have you ever wondered how close we are to eradicating one of the world's deadliest diseases? Malaria? Hello and welcome back to Victory Education Lounge. I'm your host Maurice, and today we're diving into one of the most exciting and critical aspects of global health: malaria research, how scientists are pushing for a cure. Before we get started, don't forget to hit that like button, subscribe to the channel asterisk, and turn on those notifications so you never miss a video. And I want to hear from you. Drop a comment below with your thoughts on today's topic or any experiences you've had in the fight against malaria. Let's keep the conversation going. This is a question that has driven scientists across the globe to push the boundaries of what's possible in medical research. They're on the front lines tirelessly working to stamp out this tiny parasite that has plagued humanity for centuries. And their work is far from simple. Malaria research is a complex, multifaceted field, with scientists exploring everything from vaccine development, gene editing technologies, to the creation of new, more effective drugs. Each area holds its unique promise and challenges, but together they form a comprehensive approach to tackling this deadly disease. So, are you ready to explore this fascinating world of medical research, where each discovery is a step closer to a malaria-free world? Join us as we delve into the exciting world of malaria research. Vaccines have revolutionized how we combat diseases, but what about malaria? The story of malaria vaccine development is one of resilience, innovation, and a relentless pursuit of a world free from this deadly disease. The quest for a malaria vaccine has been a long and winding road, marked with both successes and setbacks. This journey began in earnest in the mid-20th century, with the realization that vaccines could be a game-changer in the fight against infectious diseases. But malaria, with its complex life cycle and the ability of its parasite to evade the immune system, proved to be an exceptionally challenging adversary. One shining beacon in this journey is the RTS S vaccine, also known as Mosquirix. Developed by GlaxoSmithKline, Mosquirix is the first malaria vaccine to receive regulatory approval and has been piloted in several African countries. This vaccine is a beacon of hope, providing partial protection against malaria, particularly in children. It has been shown to reduce severe cases by about 30%, a significant step towards reducing the global burden of malaria. However, the path to a malaria vaccine is not without its challenges. One of the primary hurdles is that the efficacy of Mosquirix is relatively low compared to other vaccines. Multiple doses are required, which can make widespread implementation challenging, especially in resource-poor settings. Despite these challenges, the development of Mosquirix is a testament to what can be achieved through relentless scientific endeavor. It has paved the way for the development of second-generation malaria vaccines, which aim to provide higher levels of protection and overcome some of the limitations of the first-generation vaccines. While the journey to find a highly effective malaria vaccine continues, the progress made so far is promising. The quest for a malaria vaccine is not just about finding a single solution, but about pushing the boundaries of what's possible, learning from each setback and never losing sight of the goal: a world free from malaria. Could tweaking mosquito genes be the key to eradicating malaria? This isn't science fiction, but a question that researchers are actively exploring. They're harnessing the power of gene editing technologies like CRISPR to create a new front in our battle against malaria. These technologies allow scientists to make precise changes to the DNA of living organisms. In the context of malaria, the focus is on mosquitoes, which are the primary carriers of the disease. By altering the genes of these tiny insects, we could potentially stop malaria at its source. One of the most promising developments in this area is the creation of what's known as gene-drive mosquitoes. These insects carry a special trait, engineered into their DNA, which inhibits their ability to transmit malaria. But here's the kicker. This trait isn't just present in the modified mosquito, it's also passed down to their offspring. This means that over time, a significant proportion of the mosquito population could become unable to spread the disease. The potential benefits of this approach are enormous. It could lead to a sustainable, long-term reduction in malaria transmission, particularly in high-risk areas. The dream is a world where mosquitoes buzz harmlessly, incapable of causing the devastation that malaria currently brings. However, like any powerful tool, gene editing technologies come with their own set of challenges. The primary concern is the ethical and environmental implications of releasing genetically modified organisms into the wild. We're talking about making a deliberate and potentially irreversible change to an ecosystem. What if these modifications have unintended consequences? What if they disrupt the balance of nature in ways we can't predict? These are questions we must grapple with as we explore the potential of gene editing technologies. Gene editing technologies open up new possibilities in the fight against malaria, but they also raise important ethical and environmental questions. As we stand on the brink of this new era, it's crucial that we tread carefully, balancing our desire for progress with our responsibility to the natural world. In the battle against malaria, new drugs are our weapons. But how are they developed? Developing new antimalarial drugs is a complex and lengthy process. It begins with the identification and validation of a biological target within the malaria parasite. Scientists look for a vulnerability in the parasite that a drug could exploit. This could be a protein that the parasite needs to survive or reproduce, or a metabolic pathway that is essential for its survival. Once a target has been identified, the next step is to find a molecule that can interact with that target in a way that disrupts the parasite's life cycle. This is known as a lead compound. The discovery of a lead compound can be a result of screening thousands or even millions of different chemicals. The lead compound then undergoes a series of modifications to improve its effectiveness, reduce side effects, and make it suitable for use in humans. This process, known as lead optimization, can take many years. The optimized drug candidate then enters the preclinical testing phase, where it is tested in the lab and in animal models to evaluate its safety and efficacy. If it passes this stage, it moves on to clinical trials in humans. This is a three-phase process that can take up to a decade and involves testing the drug on a growing number of human volunteers. The final step is regulatory approval, where the drug is reviewed by regulatory bodies like the Food and Drug Administration in the United States. If it is deemed safe and effective, it is approved for use in the general population. The malaria parasite's ability to develop resistance to existing treatments means that the need for new drugs is constant. As soon as one drug is introduced, the clock starts ticking, and the search for the next one begins. The development of new antimalarial drugs is a critical aspect of malaria research, helping to keep us one step ahead of the disease. As we've seen, the fight against malaria is being waged on multiple fronts. From the development of vaccines like RTS S to the deployment of revolutionary gene editing technologies like CRISPR, scientists are leaving no stone unturned in their quest to eradicate this relentless disease. In the realm of drug development, the race is on to outsmart the malaria parasite, which has shown a knack for developing resistance to existing treatments. Scientists are working diligently to stay one step ahead, crafting next-generation antimalarials that target the parasite in novel ways. The path to a malaria-free world is not an easy one. It's a complex journey that requires continuous research, innovation, and global collaboration. But the progress we've made so far gives us reason to be hopeful. The future of malaria research holds great promise, and with continued effort and innovation, a malaria-free world could be within our reach. If you're passionate about making a difference, I invite you to support the fight against malaria by visiting United to Beat Malaria. You'll find the link in the description below. Together, we can help save lives and create a healthier world. Every contribution, no matter how small, brings us one step closer to a world free from malaria. Remember to like, subscribe, and share your thoughts in the comments. Together we can unveil the truths about malaria and join the battle to end this global menace. Disclaimer: the information provided in this video is for educational and entertainment purposes only. Any health-related decisions should be discussed with a licensed physician. Always seek the advice of your doctor or other qualified health provider with any questions you may have regarding a medical condition.